Hi, I'm Dr. Mark Berman. Many of you know me from the Wellness Hour, where I've talked about the pocket protector and breast augmentation surgery. Well, today I want to talk to you about something different. It's called the space lift. What's a space lift? Well, let's talk about the aging face. As we get older, we start losing volume in our faces. And this is something we really haven't addressed that well in cosmetic plastic surgery. So what I want to talk to you today is about how we recreate the youthful face and keep it youthful and natural. Now let me tell you something. Several years ago, I sat down with my wife's grandmother and I asked her, I said, "Hey Gram, how old are you inside your head?" Well, she was 88 years old. And she turned to me and she looked at me and said, 18. And as a 52-year-old person now, I understand exactly what she means. If you're in reasonably good health and you have a good attitude about life, then you're going to have that best image of yourself inside your head. I know I still think I'm a 20-year-old kid inside, and when I look in the mirror sometimes it works and sometimes it doesn't. And that's why I want to tell you about how we can turn back the clock in a natural way. And so I'm going to use a PowerPoint presentation and be able to explain to you and show you some demonstrations about how we actually age and how we correct this problem using your own natural tissues, usually fat, transplanting it into the face so that we lift the tissues away from the skeleton. I just gave a talk recently at the facial plastic meeting. I asked the doctors, what are the vectors of pull to correct the aging face? And almost everybody raised their hand and said, you want to pull it up and back, up and back. Well, guess what? There's another vector that's even more important, and it's called anterior. In other words, away from the skeleton. So think about it. If we just pull your skin back like that, are we really putting it back where it used to be? This point on my cheek didn't start up here and fall down. It started somewhere out here. So that's what we're going to talk about today. I sure hope you enjoy this information I'm going to present to you. Well, let me tell you, the traditional idea of aging deals with gravity pulling the face down. And so on the slide you can see here that we talk about gravity, loss of elasticity, photo damage, but that's not it. That's not the only thing. Basically, I have the perspective that it's loss of volume. And this is what we're going to talk about, what I just mentioned. And let me show you some examples of what we mean. When you see a young woman in a photo, you're going to see low brows and fullness. You're going to see fullness around the cheek. Pull out some of your old photos and look and see if I'm not right. Where you're getting maybe flat in the brow and flat in the cheek, where the temporal areas are caving in, it used to be very full and very wide. So when you look at some of these models, particularly from the side, you notice that the brow is not just up or down, it may be out. It's a three-dimensional object. Your face is three-dimensional, the brow's three-dimensional. When we go to medical meetings, we'll look at the brow on a slide and we'll see our faces up and down. So we think, gee, where should the brow be? Should it be here, a little bit higher, a little bit lower? But how about out away from the face? So all these things come into play. When you look at a picture such as this on the screen here, you'll see a model with the brow just starting to descend. Most people would think she has extra skin. I look at it like somebody's let the air out of the tire. And how about this patient here? When you look at this photograph, this is obviously somebody who's had a very good facelift. There's no extra wrinkles on her face, no extra skin, but she doesn't look younger. She just looks like she's been tightened up. Now, that may be good for some of you. Maybe you want to look that way, just have your skin stretched tight over the skeleton. But I think most people really want to look more natural, and it can be accomplished. Here, a very well-known surgeon did some work on this patient's face. I look at the eyes, and she may look better, but the eyes don't look natural. Here's an example of a surgeon's work where he lifted the eyebrows to show you how the eyebrows look better and the whole eye complex looks better. But indeed, does this look natural or does it look like the patient's been surprised? Another example from the same surgeon. This looks like somebody just surprised the patient and scared her. I think there's a way of repairing this and make it more natural, and we'll show you that in a few moments. Now, where do you lose the fat? Well, there's a large compartment of fat that's called the buccal fat compartment. It goes around all the muscles of mastication. Well, when you chew, when you bite down, you can feel the masseter muscle tighten. You can feel the temporalis muscle tighten. From the top of your head down to the bottom of your jaw is the muscles of mastication, and the buccal fat compartment has fat around all of those muscles. For example, if you look at this slide here, you'll see that here's fat all the way up to the temporal muscle and down into the cheek. Well, when you remove just a little bit of that fat, you can get an example such as this. I took this right out of a Plastic and Reconstructive Surgery journal years ago to show that by removing just a small amount of the buccal fat, they made this patient actually look older. Now she's got grooves under her eyes, temporal recess, nasolabial fold, marionette lines, where before she didn't have them. So, what else can you do? Well, I recommend that when you come into the office for a consultation, bring a picture of how you look in your head. That might be your high school yearbook, something from college, or maybe a photo a few years ago where you really liked the way you looked. And we can examine the way you look now and that picture and see what the changes are. There are three-dimensional changes that need to be addressed. And typical facelifting, brow lifting, eyelid surgery does not address that. If anything, it distorts those changes in most people. This is an example of a mother and a daughter. And you can see this is somebody you might recognize, a fairly well-known designer. And here she has a lot of deepening in the orbital rim area because she's had her skin and fat removed, which is typical of most blepharoplasty procedures. You can see her daughter has a very full face and full structures around her chin. The mother doesn't look bad, but she could look better. Now here's this slide that's very important. This shows a rope that's hanging from a wall. On the left-hand side of the screen, the rope is held out by a presumed volume. Let's presume this to be fat, like your eyebrow. If you were to reduce that volume, thereby reducing that radius, what happens to the rope? You have the exact same amount of rope, but now it's sagging. It appears to be sagging. Would you correct this problem by cutting off the rope, or would you fill the volume back up? Our faces are almost like a beach ball. If you take out some volume, it will collapse a little bit. Would you fix that ball by tightening the ball up, or would you expand it with more air? And so when you look at the face and you start seeing, like I'm getting, some of this neck muscle sagging, bags under my eyes, why is that happening? At 52 years, what's happening, I'm losing fat in my face. How do you lose the fat? We simply metabolize it. And just by living, we need to use this fat for energy, for resource, for making different hormones in our body. And so as the fat depletes over time, things collapse a little bit. And then you can see the underlying structures in the face, such as the natural bag in your eye, which is the fat surrounding the eyeball complex. The neck muscle begins to sag because you have a vertical length of muscle that comes up onto the cheek like this. So as my cheeks cave in a little bit, where does that muscle go? It goes down into the neck. If I were to fill up my cheeks just slightly, it lifts the neck up. So you don't have to always cut and pull and lift the muscles up like this. You can actually fill the face in. Now, how do we do this? Well, there are several things you can do. You can put implants in under the skin. You can affect a facelift with different injectable materials. You've heard of Restylane, perhaps, collagen. Well, we're using fat, by and large, because that's what's missing. And the way we use it is we suction out a little bit of fat from a part of your body where you don't want it. Most people, fortunately, have fat in their abdomen, in their hips, their thighs, and areas they would like to lose it from. So we use liposuction techniques to simply remove, and very safely, by the way, remove some fat under intravenous sedation and local anesthesia. This is not done under general anesthesia. And by taking out that fat, we can then transplant it into the face where it's missing. And we use, as this slide shows, blunt-tipped needles so they won't harm the nerves and blood vessels in your face. And then we slowly inject little pellets of fat. The fat looks something like this. In this slide you can see these little tiny pellets. And this is the key. Imagine then little building blocks of fat, multiple areas of fat where we just build up the face in stages. And the idea is by putting in tiny packets of fat, not big clumps, the body can actually revascularize that fat and becomes a living part of you. And it will last. It will last a long time. I'll show you a couple of pictures of patients who are 7 years after surgery. In fact, you may recall that people will often say, when you have a facelift, how long does it last? And they'll tell you 7 to 10 years. Well, what happens in 7 to 10 years? Well, basically, you lose more fat. And think about it. Think about your friends who've had their second facelift. what happens is their face collapses and they say, oh, I got too much skin. They get a facelift again and they start looking like a skeleton because their face loses the youthful volume, the things that make us look young and look like we do in our mind. Here's an example of a patient who came to me with very heavy bags under her eyelids. And every surgeon I showed this slide to said, oh, this would be a very easy procedure to fix by simply removing that fat. Patient didn't want any cutting. And of course, she chose the right procedure. By simply putting fat back into the cheeks, and this woman has pretty full face, as you can see, we were able to lift the cheek skin away from the skeleton and restore the natural appearance and hide basically the fat under the eye. Now, why wouldn't you remove the fat from the eyelid? Sometimes there's a place for removing fat. If you come to me and you say, I've always had baggy eyes, even as a kid, there may be a point in removing some of that fat. But most of us don't see the fat until we get older. That means the skin's collapsing, just like a tent falling down on top of everybody underneath it. If a tent collapsed over the circus, you wouldn't remove the elephant to fix the tent, you would prop the tent back up. One of the problems here is if you remove fat from that eye, you're actually decompressing the orbit. And that eyeball can fall further back into the socket and make your eye look smaller. We know that what an attractive face is someone who has pretty eyes, full lips. Now, most women, you want to see big eyes. And as we get older, what happens? Our eye falls deeper into the socket. By removing fat, we just speed up that process. Here's an example of somebody who came to me from Tennessee, had long, thin features, and she was a little petite gal. So we added fat back to her face. A lot of people think it's not even the same person, but she looks more like this person than the original person in her mind's eye, and that's what we try to create. Now, sometimes you'll look at yourself and think, gee, I'm kind of fat. Maybe I need fat removed. Well, on this slide, you see somebody who looks like she has a full face. But the reality is she's lost volume and she's losing the definition of her face. By putting fat back in around the chin and the jawline, and even around the brows and the cheeks, we restore contours to give a more pleasant-looking face. We're going to go over a lot of examples right now, and perhaps you'll see something that reflects what you have on your own face. Here's a very simple example of somebody aging around the eyelids. A little bit of extra skin could easily be removed with a blepharoplasty cutting technique, but by putting a little fat back around the brow, we restore the natural contours. Again, somebody has a little redundant skin, fat's put back in around the brow, around the cheek. And the way we do it is by making multiple passes over the orbital rim, over the brow, even up into the forehead, out into the temporal area, underneath the cheek, on the bone, and within the soft tissue of the cheek. All this is to lift the skin up. Here's a lady with big bags under her lower lids, and she didn't want any excision. We moved the fat down a little bit on her through a technique which is called a transposition procedure, but mostly added fat back to the cheek and around the brow. Here's an example of a young man who has fairly prominent bags. But if you notice, the cheeks are somewhat flattened. By adding fat back to the cheek, effecting a space lift and lifting the cheek away from the skeleton, you neutralize the defect of the lower lids. This gentleman shows bags under the eyes and a malar ligament. Sometimes when you see that crease across the face, what you're seeing is a ligament that stops the skin from falling any further. That's called the malar ligament. Up here, or under the bag, we're separated by what's called the arcus marginalis. So the face is somewhat compartmentalized, but in youth we don't see it because the skin is being held away from the skeleton. By putting fat back into the face, we restore those volumes and neutralize these defects. This young lady always thought she had heavy lids, so she asked that I remove some of the skin. Indeed I did, but not without replacing fat, so that now her brows look round, convex, and even though the brow is lower, it's in a more pleasant position. Now we age in different ways. some people, when they're young and still have good elasticity, may lose fat and get hollowing around the eyes, as did this person. And so what we want to do is put more fat in so it doesn't look so hollow. This is another example. This is what I call involutional aging, where you have good elasticity but loss of volume, and you just need the volume to replace the natural tissues. Any cutting procedures on people like this will just distort it even more. Again, another example, a young lady going into her 40s. I just saw this patient the other day. This is 7 years later. She still looks good. This was one of my former office managers who had some flattening in the cheek. She was in her mid-30s, and just by adding a little fat around the cheek, it can restore more natural contours, as well as around the chin and the jawline. Hopefully you'll be able to appreciate these photos. Again, subtle aging, flattening around the brows, restoring the natural contours. Here's an example of somebody who looks like it would be a very easy patient to take a little fat out once again. But by lifting the face, by doing a space lift, the patient looks more youthful. She looks like herself. We haven't changed her appearance. You know, one of the things I've found as we age, most people who are seeking surgery to improve the appearance of aging have always liked their appearance. They're not really trying to change it so much. But by using a space lift, you can change it back to what it used to be without having to go through extensive surgery often. Here's a side view. You know how people always tell you your nose grows with age? Well, what happens is as we lose fat in our face, our cheeks get closer to the skeleton. And indeed, it makes your nose look bigger. So look at this side view and look how much smaller her nose looks. What's going on is you've lifted the cheek away from the skeleton and it makes your nose look smaller. Okay, here's an example of a young woman who had fat bags even as a kid. In fact, this is one of my favorite scrub nurses. This is Liz, and she just had a baby, so she's on maternity leave. But a few years ago, she had bags under her eyes, and she didn't like them. So we decided to take out a little bit of the fat, and that's done through inside the eyelids, called transconjunctival blepharoplasty, big word. But we added fat back to the cheek. So by adding fat back to the cheek, we lifted the cheek away from the skeleton and gives her a more pleasant appearance. Now, what happens is we get older, you lose a lot of elasticity. And sometimes you actually need to do a facelift. Well, here's an example of a woman who just wanted to neaten up her face a little bit without getting too aggressive. So we did fat grafting on her. Now, something I have to tell you is fat grafting is not the greatest operation in the world. I tell all of my patients you sometimes have to repeat it 2 or 3 times. Why is that? Because you're putting little grafts of fat into your body, you have to revascularize it, and it has to become a living part of you. And in order to do that, we often have to repeat the operation until we got adequate survival. The operation doesn't hurt. In fact, there's no pain in the face. Sometimes there's some discomfort in the area you remove the fat. Here's another example of an older woman who actually had had a facelift, but as she was aging, she just didn't like the way her chin and jaw looked and the general flatness of her face. So here we've added fat back to her face, giving her a more pleasant chin jawline and softened her facial features. And once again, her nose looks smaller just because of the fat grafting. Now, people ask if it lasts. Here's a patient of mine that I operated on 3 or 4 times. I think she must have thought I was selling her snake oil at the time, because after the 4th treatment, I was a little frustrated, and I thought she was frustrated, and I never saw her again. Well, guess what? She showed up 7 years later looking like this. The fat grafting obviously worked, and what happened was she then perceived recently that she was aging again, thought she needed more fat grafting. You decide for yourself. Does it last? Indeed it does. It's a living part of you that you'll metabolize again just as you naturally metabolize your own fat. As I was saying, sometimes we need to do more than just fill. As we get older, we lose the elasticity in our skin. The skin doesn't hold tight against the skeleton. So that's when a facelift is helpful. So a lot of times we'll combine a facelift with fat grafting. What I'm finding I'm not doing is doing the cutting procedures around the eyelids. And in fact, most of our facelifts can be small procedures. This was a facelift that was more extensive, but combined with fat grafting. Again, this lady required a more extensive facelift where we remove some of the fat under the chin, lift the tissues around the ear and the back of the neck, but the fat grafting was the key to restore the natural contours around the eyes, the lips, the chin, and the jaw. Again, another example of a full facelift with fat grafting. Again, full facelift with fat grafting. And once again, here's where fat grafting is really useful to fill out the chin where we lose so much fat, the jawline, the cheeks, and the brow. Now let me tell you, a lot of times people come in and they're a little bit heavy and they have fat under the chin or they seem to have fat in the jowls. A lot of the time though, this fat is just displaced because as you lose volume, everything seems to sag. Sometimes you actually have to remove some of this fat from the chin or the jowl and maybe do a little bit of lifting procedures. But almost always these people still benefit from fat grafting or the spacelift procedure around the brows and the cheeks and the lips. So here's an example of somebody's a little bit heavy and we've done a mini facelift, what I call an anterior facelift, where there's just a small incision around the front of the ear and doesn't go up into the hairline, doesn't go into the back of the hairline, and it allows us to lift up all the natural tissues underneath the skin and then put fat back into the cheeks where it's necessary. At the same time, removing fat from underneath the chin and around the jowl area. Again, more of the same. This is an anterior facelift. The neat thing about this is, on almost everybody now, we can just do a mini facelift without an extensive facelift procedure. This decreases the risk of problems from a facelift. By just having a small incision under the sideburn around the natural contours of the ear and undermining a small area of skin, we can then lift up the platysma muscle and the SMAS, that's the subcutaneous myoaponeurotic system. It's a fancy word for the fascia that holds the muscles together. And we can lift that up just like a typical facelift, but just remove a little bit of skin. And the reason we don't have to remove a lot of skin is because we're filling the envelope up with fat in the appropriate positions. Now here's another example where we did fat grafting on this patient initially, but she needed something else, so we did that small anterior facelift. And you can get a great result by just taking out a little bit of tissue. You know, Dr. Pierre Fournier from France once told me, he says, "A millimeter of change in your face can make a kilometer of difference in your heart." And now I understand what he means. So we don't have to pull the skin that tight, but we do affect millimeters of changes over the face and it makes a big difference. Another example where there's a small cut around the ear and affected a really good result. This patient may have been able to benefit from a very large facelift. Instead, we did a minimal facelift incision, fat grafted, and removed a little bit of fat under the chin and got a pleasant result. Again, another example, the anterior facelift with a nice result. And here's a close-up of the scar. So you can see it's barely visible even 2 or 3 weeks after surgery where it's red. And now you have to remember, scars fade, so over time you won't even see that at all. Again, the examples here show the more extensive scar and compared to the little anterior facelift scar. A couple more examples just so you can maybe see yourself in these images. You see how the fat grafting lifts out the brow and gives more pleasant contour to the chin and jawline. And again, a very heavy-set woman with just a small anterior incision, and she's benefited with liposuction combined with the fat grafting. You see how the cheek is flat and hanging down, and now the cheek is up and out and gives her a more youthful appearance. Now, what happens if you've had surgery done and you don't like the results? We see that all the time. Here's a lady who had her brow lifted. These are the unnatural surgical results that we've been doing because we believe this is what we need to do. The problem is when you do these procedures and you have mistakes, it has to be corrected. This patient actually had fat grafting done to fix a contour in the lower lid, a defect, what we call the tear trough deformity. Well, if you just put it in the tear trough and not around the whole cheek, you'll get a lump of fat. And so we had to remove the fat and replace it to where it needed to go. If fat grafting is done wrong or the patient is unhappy, believe me, it does last forever. Here's another example of fat grafting not done correctly. The fat was removed and replaced to the appropriate position. Now here's an example of a lady who had a very extensive facelift and her eyelid surgery. She came into my office almost in tears because she didn't like the contours of her eyelids and the way her eyes looked like they were bulging and just not natural. Using the spacelift technique with fat grafting, we can restore her natural contours. In fact, here's a picture of her 7 years later, and it's still holding up quite nicely. This young lady had a typical blepharoplasty, but look at the flattening of her eyelids and loss of her facial expression. Fat grafting restores that. Another example of somebody had a brow lift who didn't need it. And again, fat grafting giving contour back to the face. Another example of somebody had very good facelift, but lost the contours of her face. The contours are restored with fat grafting. Here's a very lovely woman who was told she had too much skin around her eyes and bags under her lower lids. And instead of improving her result, now she has a hollow eye defect. Well, you saw how we fixed the hollow eyes before. We can fix it again with the same technique of fat grafting. This woman had her brows lifted, and now she has a surprised look and a deep orbital sulcus, and fat grafting restores it to a more natural appearance. Somebody had a brow lift again who didn't need it and now has hollowing around her eyes, and that's not a youthful appearance. When you lose a lot of fat around the temporal area and then do a blepharoplasty, sometimes you can skeletonize the eyes and you can get that kind of a witchy look. But by restoring the temporal area and lifting the brow up and out, you can get a more youthful contour. This person had 3 eyelid operations to get rid of the defect on the left lower lid. By lifting the cheek away from the skeleton, the defect is gone and she's got a pleasant contour. Again, too many facelifts, too many blepharoplasties, you start losing the natural contours. And again, a facelift or two later, loss of definition around the chin and jawline, which is restored with the spacelift technique. By the way, they say your hands can give away your age. They don't have to. There's procedures you can do on your hands, including spacelift techniques, to put volume back in the hands and remove some of the tendinous, veiny show of your hands, of the aging hands. So the hands can be improved, and sometimes it takes 1 or 2 procedures, usually about 9 or 10 cc's of fat to affect a good change in the hands. So, thanks for spending the last half hour with me here in the office talking about the spacelift. Obviously, it's a favorite topic of mine. I look forward to meeting you in person and answering any questions you might have in the future. Thank you.